Good evening and very warm welcome to one and all present here for the webinar on stomach cancer, No Stomach for Cancer. We have often heard the quote as the way to a man's heart is through his stomach. This was quoted by Fanny Fern, or a hungry stomach cannot hear, that was written by Jean de La Fontaine. This shows that stomach is the most important organ which not only keeps the body healthy, it also affects one's moods and feelings. But in present scenario, due to unhealthy lifestyle, faulty food habits and polluted environment, this very important organ is getting diseased. Globally, stomach cancer is the fifth leading type of cancer and the third leading cause of death from cancer. As per statistics, before 1930s, in much of the world, including most Western developed countries, it was the most common cause of death from cancer. Stomach cancer occurs mostly in East Asia and Eastern Europe. It has also been observed that it occurs twice as often in males as in females. So to get a better understanding about this deadly disease, let's start the panel discussion on the topic stomach cancer, no stomach for cancer. I am Manjari Bajpai, clinical dietitian at DS Research Center, Varanasi. I have been associated with DS Research Center for past 9 years, and it's been a privilege for me to moderate this panel discussion with two eminent personalities from North and South. As 2 days before, our Honorable Prime Minister inaugurated Kashi Tamil Sangamam. Likewise, here we have Kashi Karnatak Sangam. Our first panelist is Dr. Mainak Chakravarti from Varanasi. Dr. Mainak is MBBS, MS, DNB, MCH Surgical Oncology. He has done his MCH Surgical Oncology from Institute of Medical Sciences, BHU. He has ranked All India 77 among all general surgeons in India opting for super specialty in surgical oncology. He has performed 250 plus complex oncological procedures independently and has supervised more than 700 cases. So he has a vast experience in this field. His surgical experience is in head and neck oncosurgery, thyroid parotid cancer surgery, thoracic cancer surgery, breast cancer and oncoplasty, upper GI and lower GI oncosurgery, hepato, pancreatico-biliary surgery, sarcoma and bone cancer surgery, gyneco-oncology, pediatric and uro-oncology. His membership, he has a life membership of Association of Surgeons of India and a lifetime member of Royal College of Surgeons, England. He has some publications to his credit. He has his article published in World Journal of Surgical Oncology titled Caring for Cancer Patients in COVID Pandemic, Choosing Between the Devil and the Deep Sea. We welcome you, sir. Our next panelist is Dr. Divya S. from DS Research Center, Bangalore. She has done her BAMS and MD in Panchkarma from Government Ayurvedic Medical College, Bangalore, Rajiv Gandhi University of Healthcare Sciences, Karnataka. She has 12 years of experience in Ayurvedic practice. She has been associated for past 4 years with DSRC Bangalore. She has worked in NIMHANS as senior consultant. She has been working as medical officer in MS Ramaiah Indic Hospital, Shatayu Ayurved, and Vedam Ayurveda Multi-Speciality Hospital as medical officer. She was consultant to many Panchkarma centers. We welcome you, ma'am. So to start with, I would like Dr. Chakravarti, the first question, that is, what is stomach cancer and what are its causes? So kindly elaborate.
Thank you for having me. It's a great pleasure to be in such a national platform and discussing on a very dreaded disease like stomach cancer. The problem is with stomach cancer is that it is not something that can be easily diagnosed. It is not diagnosed early because the manifestations or the symptoms of stomach cancer are very similar like a gastric ulcer. So patient can get over-the-counter medications and get relief from the symptoms. So the stomach cancer can grow inside without having a lot of obvious symptoms. And by the time patient is having definite symptoms, the disease has already progressed to an incurable state. So ma'am, the question was, what is stomach cancer, is it?
Yeah, and what are its causes basically?
What are its causes? Okay. So stomach cancer is most of the time, more than 95%, it is the adenocarcinoma, which arises from the lining mucosa. Apart from that, there are other form of rare form of stomach cancer, but if we are going to discuss, we will discuss about the adenocarcinoma. And based on the location of the tumor, it can be divided into a proximal variety of stomach cancer, which involves the cardia and the fundus area of the stomach, whereas the another version is called the distal stomach cancer, which mostly involve the body and the pylorus area. Uh, there are some pathophysiological differences by which this distal stomach cancer and the proximal stomach cancer can be divided, among which the lifestyle and the demography of the tumor is little different. As we can see, the previously, because of the high dietary habit, the distal variety of stomach cancer was more common, and it was found that the lower socioeconomical people, people staying close together, having what to say, like a non-refrigerated, high salt diet, those amount of people, there are some lifestyle changes, and the most important thing was H. pylori bacteria, which has been proven by Warren in 1982 that it is the most common cause of gastric ulcer as well as gastric malignancy. But however, with the change, there is a paradigm shift, because after the invention of the proton pump inhibitor, as well as eradication of H. pylori among the society, what has happened is that the amount of proximal gastric cancer has increased in the Western population more commonly, and that has been found more associated with the lifestyle as well as obesity, as well as having a higher propensity to have alcohol and a higher in combination with alcohol, smoking, which has led to increased gastroesophageal reflux disorders, and that has led to more chances of developing proximal gastric cancer. Proximal and distal, we can clearly differentiate very easily. Proximal is found more among the affluent people, whereas the distal cancer is found more among the poorer people. So this is the basic difference of or the definition of stomach cancer. And as you also, I think you asked, what could be the causes of stomach cancer, is it?
Yeah.
So as I've told, H. pylori has been found to be a very strong prognostic factor for stomach cancer. Patient who have a long-term history of H. pylori infection, it actually it's a very unique bacteria which only survives in a high acidic environment. This H. pylori cannot be found in any other gut or any other part of the body. So, and because of this reason, initially it was being thought that stomach being such an acidic environment, bacteria cannot thrive. In the entire gut, it was thought that only the stomach was the most sterile organ where no bacteria or virus or fungus can thrive. But it was found out that there are multiple bacteria that do survive in stomach, whereas H. pylori is the most pathogenic bacteria that do survive in stomach and has the propensity to cause a chronic inflammation. They have some, they cause some genetic alteration within the stomach cells where they survive, and they are called like the CAG-A gene or VAC-A genes. They actually modify the stomach cells, causing atrophic gastritis. And as we know that anywhere in the body, if the chronic inflammation is going on, it can lead to future development of malignancy. So it's the same reason how H. pylori chronic infection can lead to malignancy. Apart from that, there are some hormonal aspects has come out, like having a high estrogen hormone level. It has been found in among mostly among the females, as we know that stomach cancer has been a more prevalent among females, and it has been found that having a high estrogen burden, like delayed pregnancy, non-lactation, or not uh, not bearing child, and taking a long-term hormone supplements, or just like the breast cancer, it has been found in a particular variety of stomach cancer which are ER/PR or HER2 sensitive. They do respond to estrogen, and having a prolonged estrogen exposure can lead to stomach cancer. Apart from that, there are some lifestyle changes that I must be discussing in this platform, like high salt intake. If someone is using canned food which has high salt in them, so that to preserve those food, or using red meat or using charred meat. The amount of tandoors and roadside barbecued food, these are some of the Western style food which has come to us, and also the tandoor, which is actually from the Persian areas. Initially, this kind of food was not there. In the Indian scenario, we used to boil or used to fry, but by roasting the food, actually, some pathogens, I mean, some carcinogens are being produced, some nitrous compounds are being produced, which has been found to be more related with gastric cancers. We're using, so it is always recommended not to overindulge on tandoors or roasted foods, and not to overindulge in tandoor meats, or this non-vegetarian diet. As well as there are some, as I told, smoking and drinking together has been found to be as a complementary to increase the risk of stomach as well as esophageal cancer. And there are some, obviously, some industrial and pollutions are there, like people who are not exposed to more and more exposure to industrial pollutants, they are having the higher risk of this thing. As well as the water has some toxicity. If they're not having proper facility of having filtered or RO water, then also there is a risk, because stomach is the first source of contact of anything that you are having. So whatever you are eating is very important, takes a very important role. And apart from that, not eating a lot of green vegetables, not eating fruits and all this stuff, not taking antioxidants, these are also having a lot of effect in stomach cancer. Thank you, ma'am.
थैंक यू सो मच सर. एक्चुअली आई जस्ट वांटेड टू आस्क कि अभी आपने कहा कि जो हम तंदूर वाली चीजें जो ले रहे हैं, बेसिकली इट इज ओनली विद द नॉन वेज फूड, या वेजिटेरियन फूड भी जो तंदूर में आ रहा है वो नहीं लेना चाहिए?
मैम, अभी तक जितने सारे स्टडीज हुए हैं, मोस्टली इट हैज बीन डन ऑन द बीफ, सो ऑन द नॉन वेज beef, like the roasted beefs and the roasted chickens, they have been found to be having this kind of carcinogens. I'm
बीफ तो
not sure
ठीक
whether,
है.
हाँ,
हाँ,
मतलब कुछ भी तंदूर में लॉन्ग टर्म या डेली लेना मना किया जाता है. बारबेक्यू या तंदूर करके जो लेते हैं हम लोग, जिसमें चार्डिंग होता है, जो चारकोल जो सरफेस में आता है यानी फूड में, वो अनहेल्दी होता है और उसको बहुत ज्यादा ओवर इंडल्ज नहीं करना चाहिए.
so it's like once a week or once in a fortnight?
Yeah, it's better, it's always better not to have daily tandoors. It's better to avoid.
ओके, एक चीज और पूछनी थी, क्योंकि जो अगर ये जनरल लोगों के है, हम लोग एच पाइलोरी पे बात कर रहे थे. एच पाइलोरी का इन्फेक्शन सबसे ज्यादा किन चीजों से हो सकता है? मतलब ऐसी कौन सी चीजें हैं जो लोगों को अवॉइड करनी चाहिए? क्योंकि ये तो ऐसा पैथोजन है जो कि किसी भी एसिडिक लेवल पे जा सकता है. और जिन लोगों को बेसिकली हाई अपर एसिडिटी की प्रॉब्लम है, क्या वो लोग ज्यादा प्रोन है इस डिजीज के होने के लिए?
नहीं सर,
अल्सरेटिव
मैम,
कोलाइटिस.
इट इज नॉट लाइक दैट. एच पायलरी किसको होगा किसको नहीं होगा ये बहुत कहना मुश्किल है. मोस्टली लोअर सोशो इकोनॉमिक, और जहाँ पे बहुत सारे एक साथ इकट्ठे रहते हैं, कहा जाता है कि एक इंसान जिसको घर में एच पायलरी है, बाकी लोगों को भी एच पायलरी मिलना चांस ज्यादा है. तो हाउ इट स्प्रेड्स, पीपल आर नॉट वेरी मच अवेयर कि कैसे होता है खान.
अच्छा, ओके.
पर ऐसा है कि लोअर सोशो इकोनॉमिकल स्टेटस और बहुत ज्यादा लोग इकट्ठे रहने रहने खाने में ये स्प्रेड होता है. लेकिन देर इज नो डेफिनेट रूट कि हाउ इट इज स्प्रेडिंग. बहुत ही कम उम्र में ये आ जाता है और उम्र भर रहता है.
मतलब
और
इसका
किसको
मोड
है
ऑफ इन्फेक्शन अभी तक पता नहीं है कि एच पाइलोरी का मोड ऑफ इन्फेक्शन कहाँ से है? ये
बहुत
कैसे?
स्पेसिफिक तो, हाँ, बहुत
नहीं है
स्पेसिफिक तो है ही नहीं.
जी.
ओरल रूट है, ये तो पता है कि ओरल रूट ही है, बाकी कुछ है नहीं.
जी.
फूड रिलेटेड ओरल रूट है. लेकिन एक घर में किसी को एच पायलरी है तो बाकी सबको एच पायलरी हो जा रहा है, ये कैसे हो रहा है, ये अभी भी इतना क्लियर नहीं है. लेकिन ऐसा दिखता है कि उस लोकेलिटी में या उस एरियाज में एच पायलरी मिलने का चांसेस ज्यादा होता है जब घर में किसी को एक हो.
एक और चीज यहाँ क्लैरिफाई करनी है कि आपने बोला है डिस्टल जो कैंसर है वो ज्यादातर
यस,
लो सोशियो इकोनॉमिक ग्रुप में होता है.
यस, यस, यस,
ऐसा
यस,
क्यों
यस.
है?
ये एच पायलरी के लिए ही है. एच पायलरी डिस्टल कैंसर की है, बहुत एक प्रोमिनेंट रोल प्ले करता है, क्योंकि डिस्टल कैंसर मोस्टली गैस्ट्रिक अल्सर या एट्रोपिक गैस्ट्राइटिस के बाद डेवलप होता है. इसलिए डिस्टल कैंसर थोड़ा स्लो प्रोग्रेसिंग भी होता है, और डिस्टल कैंसर का प्रोग्नोसिस थोड़ा बेटर भी होता है. लेकिन जो प्रॉक्सिमल वाला कैंसर है उसमें एच पाइलोरी का उतना रोल मिला नहीं, रादर उसमें लाइफस्टाइल चेंजेस का रोल ज्यादा मिला है। और पीपीआई इंड्यूस्ड एच पाइलोरी इरेडिकेशन के बाद ज्यादा देखा गया है कि प्रॉक्सिमल कैंसर ज्यादा बढ़ रहे हैं। तो ये एक पैराडिम शिफ्ट हो गया है। जैसे पहले डिस्टल कैंसर मोर एंड मोर एच पाइलोरी एंड दिस काइंड ऑफ हाई सॉल्ट डाइट और हाई क्या कहते हैं हाई चार्ट डाइट से बनता था। देखिए ऐसा है कि जो पिकल्ड फूड भी होता है ना, जो हम लोग कहते हैं कि पिकल्ड फूड, जो कैंड पिकल्ड फूड होते हैं वो भी हाई सॉल्ट होते हैं। और उसमें भी एक एक चांस रहते हैं कि उससे भी किसी को स्टमक कैंसर बन जाए। तो जो पीपल जो कैंड बीन्स लेते हैं या कैंड फिश मिलता है, जो अगर कोई सोचे कि मैं लाइफ टाइम सिर्फ वही खाते रहूंगा तो उसको डेफिनेटली हायर रिस्क है। दीज आर सम ऑफ द फैक्ट्स जो प्रूवन है। तो ये सारे डिस्टल कैंसर के लिए बात कर रहे हैं। ऐसे मैं एक एग्जांपल आपको दे सकता हूँ कि दुनिया भर में स्टमक कैंसर पहले जितना प्रिवलेंट था, आफ्टर द इन्वेंशन ऑफ रेफ्रिजरेटर, रेफ्रिजरेटर आने के बाद जब खाने को बहुत ज्यादा सॉल्ट चार्ट करके स्टोर करने का जरूरत नहीं पड़ा, rather people could preserve the food and it was kept fresh for long, स्टमक कैंसर का परसेंटेज काफी कम हो गया सोसाइटी में बाय यूजिंग रेफ्रिजरेटेड। मतलब यही है कि खाना बहुत फ्रेश होना चाहिए। आप अगर बासी खाने का आपको शौकीन है तो आपको एक रिस्क है।
Thank you so much, sir. My next question to Dr. Divya. How has the present modern lifestyle led to raise in stomach cancer cases across the world? If you can elaborate.
Yes. Stomach cancer is one such disease which is inevitably associated with food intake. Now, in present modern lifestyle, what has happened is people are so busy that they don't have time to have their food peacefully. So, what they do is they have food when they are free. Now, if they are not free, the food will either be delayed or it will be skipped, and then no time to cook or no interest to cook, so having food outside almost every day. Now outside food is rich in artificial colors, taste makers, trans fat, harmful chemicals, soda, whatnot, to cause stomach cancer. And then you have this ready made instant food. You add hot water and your food is ready. You eat that food, your tummy is full and the health is gone. So such packed and processed food have increased, and then aerated drinks have increased. And definitely aerated drinks, which are, it contains a whole lot of harmful chemicals that go into the body, and could be a cause for cancer. And definitely alcohol and smoking has become a fashion today. Like if you don't smoke or drink alcohol, people would call what a nerd you are. So this kind of attitude has actually been pushing the youth to alcohol and smoking. Then excess of junk food, excess of red meat, as the doctor said, then having non-veg food almost every day, and with minimal or no physical activity. This not only increases obesity but also increases cancer cases as well. So this was about the food aspect. Now apart from that, you have these late night parties, going to bed late, and having heavy food at 12 o'clock or 1 o'clock in the night, and lack of sleep, excess of stress, and working in shifts, like 1 week night shift, next 1 week will be day shift. So if this repeats for a longer period of time, the whole biological clock will be disturbed. So what happens because of all these reasons is it leads to hyperacidity. It increases the acidic level in the body, and acidic medium helps in growth of cancer cells. So because of increase in acidity over a long period of time, acidity, hyperacidity, if ignored, leads to gastritis. Gastritis on a long run, if ignored, leads to gastric ulcer. Then gastric ulcer on a long run, if ignored, leads to stomach cancer. So in this way, the modern lifestyle has been a cause for rise in stomach cancer.
Okay. I wanted to ask, जैसे अभी डॉक्टर साहब ने भी बोला कि जब से रेफ्रिजरेटर हम आया है तब से स्टमक कैंसर के केसेस कम हुए हैं ड्यू टू लो सॉल्ट और उनको प्रिजर्व करने के लिए. But when we are talking about junk food or packed food, it is the same thing. Again, high in salt. So, what is the ratio actually? Today, is the stomach cancer cases more prevalent due to this lifestyle disorders? To you, so both of you.
I cannot say that it is the. I'm having some echoes problem.
Something is going on.
Hello.
Yeah, it's okay.
Okay. So, देखिए, is the prevalence of all cancers are actually going up. You cannot just say कि नहीं, by refrigerations and by having this thing. Westernization of diet is the main culprit out here. In the Japanese people, they have a high rate of stomach cancer, but it is also because of their demography. It is they are more genetically built so that they have this kind of stomach cancers. That's why there is this countrywide screening program going on in the Japan, so that it can be catch hold very early, and it do get stomach cancer very early. And the Japanese people are kind of the pioneers in this stomach cancer management, in surgery and all these things. But the rest of the world, especially the Western people, the America, the stomach cancer rate is quite prevalent, very high. And but still, it is not in such a level that they are also ready to implement this. No, like what we say, this cancer screening method, because the cancer screening for stomach cancer is little invasive. You have to get a endoscopy done, and people don't like to get endoscopy routinely without any complaints. So that's the reason this is not coming up as a proper screening protocol. But definitely, the diagnosis of cancer has increased because of the awareness, as well as the prevalence of cancer has increased because of the this, as ma'am was saying, this westernization of the diet pattern. Like fast foods, people are more happy to have fast food and happy to have bahar ka khana more than ghar ka khana. So this the healthy lifestyle that was taught to us in the Indian literature or the Indian culture, if we can return back to that healthy lifestyle, ghar ka khana, so I think in the Indian population, we can curb this prevalence of stomach cancer.
Ma'am, your suggestions?
As doctor rightly said, see, stomach cancer is in the rise mainly because of lifestyle. That is, today, as I said, no time for taking care of ourselves. But even, housewives, I mean, preferably before more women were housewives. So today, be it men or women, everybody are working. So no time for self care, I would say. So I would say if you don't spend time for your health, then tomorrow you will have to spend time for your illness. If you don't spend money for your health today, then you will have to spend money for your illness tomorrow. So this is something the present, world has to understand.
I would like to add, जैसे अभी हम लोग ये बात कर रहे हैं कि जो वर्किंग है उनके लिए तो ठीक है कि उनका लाइफस्टाइल हम समझ सकते हैं कि थोड़ा गड़बड़ हो जाता है, पर हम अगर याद करिए तो हम लोगों की मदर या हम लोगों की जो चाची नानी रही है, वो लोग भी सुबह से उठ के काम करते रहेंगे और 10 बजे 11 बजे दे गोइंग टू हैव द फर्स्ट मील,
Yes.
और तब से वो लोग सुबह से लेके वो चाय पीते रहते हैं। हम जहाँ एसिडिटी की बात कर रहे हैं,
हाँ.
तो
Lack
ये
of
मेरे ख्याल से उस वक्त भी लाइफस्टाइल डिसऑर्डर तो तब भी था।
डेफिनेटली लाइफस्टाइल, ये सेल्फ केयर का लखना जो है वही है जो बी इट हो housewives or working women, whoever it is, self care is not there. And one more reason I would say, too much of fasting. There are people who fast for 3-4 days in a week and not even drinking water. So too much of a fasting on a long run will definitely lead to stomach cancers.
Okay, thank you so much. My next question to the doctor is, what are the types of stomach cancer and can it be detected in the early stages?
Ma'am, I told about this proximal and distal. There are another variety of histologically, there are different, like there is an intestinal metaplastic stomach cancer, and there is a diffuse variety of stomach cancer. And there is an uh, old age associated stomach cancer, and there is an young age associated stomach cancer. If the stomach cancer happens before the age of 40 years, it is considered as a young age associated stomach cancer. Whereas the majority of the stomach cancer, like I can say around 95% of the stomach cancer that we see nowadays, they are with old age people. This average age being 68 years, and more among the males, I would say. Whereas this younger age population, it has been found statistically among more among the females, this younger age, less than 40 years. And obviously, in younger age, you are having some genetic or hereditary predisposition. So people must be aware of what are the genetic or hereditary predispositions, what are the diseases that if runs in family, a patient can have a higher risk of contacting stomach cancer in a very early age, and that should be treated properly. For example, I can give, like, there is a hereditary stomach cancer with CDH1 gene mutation. It can be both somatic as well as germline mutation. But if there is a germline mutation, that can be detected in the family, and it can be searched for in the next generation. And if there is the mutation is found, this type of cancer happens very early and they're very aggressive. So the surgery being either to start screening very at a very early age, or asking the patient to undergo a prophylactic total gastrectomy, so that the cancer never happens in that patient. Similarly, there are some mutations, like we call it Lynch syndrome, where there are MMR mutation is there, or there is a familial adenomatous polyposis. These two cancer mostly happens in the colon because of some mutations in genetic mutation, but they can also affect the stomach. So those patients who are proven patients of FAP or Lynch, they should also be regularly screened for stomach cancer from a very early age. In a non Apart from that, there are some other diseases which are extremely rare, like Weizsäcker or juvenile polyposis syndromes, but they are extremely rare. But still, when those kind of diseases are already known that they are running in the families, the patient should be more vigilant, more aggressively screened. Apart from that, we cannot just bring around this screening protocol to every patient and ask them, okay, come, we will do an endoscopy, because it's a costly affair. It needs a doctor sitting there to observe the entire thing. It takes half an hour time. We don't have that much of resources to screen every patient. But obviously, those who are having a higher risk, like very unhealthy lifestyle, a long-term history of gastric ulcers, proven H. pylori patients, in spite of treated H. pylori, they are having persistent ulcers, uh, or having patient having difficulty, like, and if there are definitely symptoms are there, like patient ko, hello.
Yes, sir. Yes,
Yeah,
sir. Please
actually,
continue.
there is something issue with my net connection. I might not be able to continue a long term. I think my net is almost over. So I would like to conclude saying this only, that if my connection goes off, please continue on yourself. I won't be able to continue just now. I might able to join after 15-20 minutes. So what I was saying, that there is early screening. There is nothing called early screening. Only for symptomatic patient, uh, they needs to be evaluated, and endoscopy is the only option that we can detect it early.
Ma'am,
I
you
think,
are
ma'am,
not
you are
audible.
muted.
Coming to you, Dr. Divya, what are signs and symptoms of stomach cancer?
Stomach cancer most often presents with, symptoms of a hyperacidity like burning sensation in the abdomen, then pain in the abdomen, nausea, vomiting. Vomiting can be with or without blood, then reduced appetite, tastelessness, indigestion, and then there could be blotting of abdomen and too much of belching or too much of sore erectations and feeling of fullness. Even if the person has a small meals, he feels fullness. Then weakness and unintentional weight loss. So these are the signs and these are the symptoms which are seen in stomach cancer. And at the earliest, if it is detected and further needful is done, the prognosis will be better. Most often it gets ignored, thinking that it is a simple gastritis or simple hyperacidity. So people tend to take one antacid and continue that, taking one antacid every day for years together. So that subsides, the condition subsides the symptoms only in the time being. So when this continues on a longer run, then the disease progresses and the diagnosis will be detected quite late and prognosis might be bad. So these are the symptoms which everyone should take care at the earliest.
Okay. Dr. Chakravarti, are you there?
Yeah, I'm here. Can you hear me?
Okay. Can you elaborate on various therapies of stomach cancer?
Various therapies.
Yeah.
Okay, I'm audible, right? So I think I got my
Yeah, yeah.
Wi-Fi connection. So okay, that's good. I think I
Mhm.
was using my mobile internet, so it was on the verge of. Okay, fine. So what are the current therapies you are asking?
Yeah.
Right. So in stomach cancer, uh, first we need to confirm that it is stomach cancer, and we need to
Dr. Menak has left. Okay, to continue with Dr. Divya, if you can tell us about how Ayurveda is helping us in prevention of stomach cancer.
Yes, Ayurveda is not only a medical science, it is basically a life science. So, Ayurveda mainly speaks about your lifestyle, how your food should be, how your sleep should be, how your physical activity should be, how should your daily routine be, how should the seasonal regimen be. So, it basically speaks about our lifestyle. And high importance is given to the food. So there are certain standing instructions give said in Ayurveda about food, like it has to be warm and it has to be nourishing. The quantity of a food should be sufficient, should be such that it is easily digestible. So the quantity should not be very heavy, or the quality should not be such that it is heavy for digestion. And food has to be taken once the previous food is digested. And then food, the combination, like toxic combination of food should not be made. Like the individual food may not be toxic, but the combination of these foods might become toxic. So because of certain chemical changes, few toxins might be released. So that should not happen. Toxic combination of food materials should not happen. One has to take food in a peaceful place without any distraction, and one should not have food very fast or very slow. No talking or laughing during food intake. One has to concentrate on the meals while having food. So these are certain standing instructions given in Ayurveda about food intake. Then the sleep should be sufficient enough that when you wake up, you should feel fresh and active, and it should not lead to more of wanting for more sleep or feeling drowsy. So that should not be the case. So the sleep has to be at a particular timing regularly, so that the biological clock is regularized. And then physical activity is a must on a daily basis. Now when physical activity is done, the body has to sweat, and the person has to feel that the body is light and active. It should not be so less that he feel lazy, or it should not be so much more that the person feels weakness and wanting more and more rest. So this is how the physical activity should be. So, apart from these things, today there are almost every one of us can inculcate few practices in their daily routine, like having one ashgard juice or having one bottle gourd juice every day in the morning, or aloe vera juice in the morning, or wheatgrass juice in the morning, and having cucumber in every meals. So in this way, the practice can be added in their daily routine. So on a long run, what happens is, as I said you, in acidic medium, cancer cells grows faster. So these are the foods. There are many foods like this. So such foods actually reduces the acidic character of the stomach. So it reduces the acidity in the body, which helps in controlling, cancer cells, or helping or preventing the cancer cells from expressing itself. So when it becomes a routine, so day to day life, the acidity will be under control and cancer cells can be, stopped from presenting itself. So these lifestyles can be, changes can be made, wherein the Ayurveda plays a major role in prevention of stomach cancer. So, if the disease is already presented, then Ayurvedic medicine will help in improving quality of life if the patient is undergoing the mainstream treatment. Like wherever surgery is required, it has to be done. So, apart from that, Ayurveda helps in avoiding recurrence. It helps in improving the quality of life. It helps in extending the life expectancy of the patient. In spite of multiple metastases, still the patient can extend their life expectancy, and as long as his immunity is good, patient will be able to tolerate any treatment, any aggressive treatment you give, and the patient will be able to control the disease growing out of control. I mean, growing quite faster, I would say. So these way, Ayurveda helps a lot in lifestyle modification and thus preventing cancer. And if cancer is already caused, then quality of life and extension, life extension, avoiding recurrence. In this way, Ayurveda has a major role to play.
ओके, आपने अभी बात की नो टॉक्सिक फूड कॉम्बिनेशन.
Yes.
Can you elaborate on what are the foods that should not be taken
Few things,
simultaneously?
yes, few things which Ayurveda has in specific said, like honey should not be heated. Honey should not be mixed with hot water, because honey is made from nectar from all the flowers. So bees doesn't distinguish if it is a normal plant or a toxic plant. So even from toxic flowers, nectar will be collected and honey will be prepared. So because of that saliva of the honey bee, so it becomes dormant. So when honey is heated, that toxin becomes active. So that is the reason honey should not be heated and it should not be mixed with hot water. And Ayurveda says honey and ghee should not be mixed in equal quantity. Then fish and milk should not be taken together. And non-vegetarian food, any meat for that matter, any meat along with honey, it should not be taken. So in this way, there are a whole lot of combinations which
Uh,
forms
if
toxins.
honey should not be taken with any of the non-veg foods, but most of the time now there are so many cuisines which are adding honey, and they are preparing it while they are cooking it only. They are adding that honey to it.
True, true, true. There are so.
Normally,
Hmm.
आप honey को
Actually,
कहते हो नहीं नीचे
Ayurveda
या
even says that the curd. No, Ayurveda even says curd should not be heated. Curd should not be heated. But today, in some non-veg dishes, actually curd is added and it is cooked in curd only. So they all add toxins, is what Ayurveda says.
so these are basically our preparations which are going wrong.
Yes. Yes.
Even we at home are preparing it in that way only because to take that taste. We are preparing it at home in this. We are getting that recipes and we are preparing it at home as well. So we should
Yes,
not be
yes.
doing that because I have
Yes,
heard that
definitely.
should not be taken in combination. But
Yes.
still, to the gravy, we are adding milk also there.
Uh, uh, uh. Yes. And even there is a general practice that lemon, hot water, and little bit of honey reduces your body weight. Actually, that should be warm water. It should not be hot water. So that people should know. So if honey is heated, not that it will become toxin, but we don't know from where all the nectar is collected. If the nectar is from a toxic plant, then definitely that toxin will be activated. And it first hampers the metabolism. That is the first thing it does. And slowly, all the diseases, it need not be cancer only, but any disease for that matter, is slowly, if it is a regular intake, if this practice is for longer period of time, then disease is bound to happen for sure.
Acha, we were talking about like people should not fast for longer time. Your take
Yes.
on intermittent fasting.
See, as long as fasting is concerned, I would say once in a week is fine. Once in a week is fine because it is, as I said, you basically related to acidity only. And I have seen few patients who do fasting, but they take tea the whole day. So for tea, there is no fasting, but only for food there is fasting. So again, tea, coffees, they also increase acidity. You are not taking food, solid food, that is also increasing acidity, and you have created a very good atmosphere for cancer to grow. So any part of the body, if it is irritated for a longer period of time, be it stomach mucosa, oral mucosa, as in case of tobacco chewing, and in case of mucosa of the rectum because of chronic constipation. So any part of the body which is irritated for a prolonged period of time will inevitably lead to cancer. So fasting is also again related to the same. You do any fasting, not a matter, but it should not be like 3-4 days a week and you eat food only 2 or 3 days a week. That should not happen. You should not create an atmosphere for acidity to build up.
So intermittent fasting should be done, but it shouldn't be done. Like intermittent fasting goes for about a week.
So,
That 8 hours window is there where you can have and every 16 hours you are
see,
doing
if
nothing except
intermittent fasting is done for a week, then it has to be, continuous also. There are people who already have hyperacidity and now they do intermittent fasting. Then already the atmosphere, acidic atmosphere is already set.
exactly.
And then they continue this fasting. And once that 1 week is over, they again start hogging. So everything is causing hyperacidity.
So basically it's our lifestyle which is causing the problem. अच्छा एक और बहुत इम्पोर्टेंट चीज जो मुझे पता पूछनी है, कहते हैं कि
हाँ.
पेट ठीक है तो सब ठीक।
हाँ.
What about the constipation problem? क्योंकि ज्यादातर लोग constipated हैं। Is it
See
a
what
cause
Ayurveda says.
of stomach cancer? हाँ जी।
What Ayurveda says is if we call it Agni. Agni is digestive power. Okay. If Agni is bad, only then constipation will occur. There is no use of giving medication for clearing constipation. It is only symptomatic. If you give medication for clearing your bowel, so that is only symptomatic. For time being, the motion will be cleared, constipation will be cleared, but it will come back. The medicine should be given for improving the digestive fire. So it has to be given for improving Agni. That is what we say. So if digestion is good, constipation will not happen. If there is constipation, do not give medication for treating only constipation for a longer period of time. that is not going to solve the problem for sure. You have to work on improving the digestion. And definitely, yeah, constipation leads to again hyperacidity, blotting of abdomen, so reduced appetite. So all these again it can lead to stomach cancer.
One last question.
Yes.
Uh, Actually, any of such drug or any therapy or anything, जैसे aloe vera juice or wheatgrass juice you were telling about, anything which is there which can cause this agni all the time, वो उसको कम ना करे,
Agni to
मतलब अग्नि हमेशा रहे. जैसे हम कॉन्स्टिपेशन के लिए हम नॉन मतलब एक फॉर्मूला दे, दैट इज सिम्टोमेटिक ट्रीटमेंट, पर अग्नि हमेशा ठीक रहे पेशेंट की, उसके लिए कोई ड्रग है आपके पास?
हाँ, अगर एक पर्सन हाइपर एसिडिक नहीं है तो नॉर्मल पर्सन, तो उनके लिए जो जिंजर गार्लिक पेस्ट दैट वी यूज इन द cooking or all the spices, Indian spices, they are boosters of Agni, but it has to be taken in limited quantity. If it is taken in higher quantity, again the Agni becomes more to an extent that it will start causing burning sensation. So the Indian food basically has all the ingredients to keep the Agni in a good condition. Fasting also increases Agni, but you should know how much to do. You should know how much spice to be used. So all the Indian spices are boosters of Agni. ऐसे
Thank you so
वैसे
much.
आयुर्वेदा में या फिर कोई भी हेल्थ रिलेटेड जो फूड रिलेटेड है, देयर इज नॉट अ सिंगल थिंग टू डू. देयर आर हंड्रेड्स ऑफ थिंग्स टू चूज फ्रॉम, बट वी शुड नो what it does before we eat it.
Thank you, doctor. Thank you so much. So the takeaway message is that we should follow proper lifestyle. No toxic food combinations to be taken. In physical activity, we should have that physical activity, like 20 minutes of workout every day, and don't fast for a longer time to avoid that acidic
Yes,
problem
true.
which can cause stomach cancer. Thank you, Doctor. Chakravarti has already left. Thank you, Dr. Divya, for such an elaborative insight on all the
One
topics.
more take home message I would say from my end is, if your lifestyle food, if your food is good, then your food becomes your medicine. If your food intake is not good, then your medicine will become your food. That is take home message from my end.
Thank you. Thank you so much. It was really a pleasure listening to you both. Thank you all for joining. Thank you. Take care.
Thank you.
Bye.
Mhm. Bye.